Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is November 10, 2025. This video is on a New England Journal of Medicine article published 2 days ago, November 8, 2025, titled Antithrombotic Therapy After Successful Catheter Ablation for Atrial Fibrillation. The study was titled the Ocean Trial. Afib ablation reduces Afib recurrence, but impact on stroke risk is uncertain. So these investigators randomized 1,284 patients with greater than 1 year post-successful Afib ablation. They compared Rivaroxaban 15 mg daily versus aspirin 70 to 120 mg daily. They included patients with charged VAS score of greater than 1 and greater than 2 for women or vascular disease. Follow-up was 3 years with a head MRI baseline, and at year 3, mean age of the cohort was 66 years, 28.6% were women. The mean charged VAS score was 2.2. The primary outcome was stroke, systemic embolism, or new covert embolic stroke. Statistical plan was intention to treat. Relative risk, hazard ratio, and confidence interval 95% were included. What did they find? Primary outcome was 0.8% in the Rivaroxaban group versus 1.4% in the aspirin group. Relative risk was 0.56, p-value equals 0.28. Stroke and systemic embolism was 0.8% in the Rivaroxaban group versus 1.1% in the aspirin group. New cerebral infarcts less than 15 millimeters was 3.9% in the Rivaroxaban group versus 4.4% in the aspirin group. Major bleeding was 1.6% in the Rivaroxaban group versus 0.6% in the aspirin group. Non-major bleeding was higher with Rivaroxaban. What are the limitations of the study? Event rates were much lower than anticipated, underpowered for small treatment differences, no extended AFib monitoring. Key takeaways: stroke risk after successful Afib ablation therapy is very low. Rivaroxaban was not superior to aspirin. Bleeding risk was higher with the Rivaroxaban anticoagulation. Clinical pearls of the Ocean Trial. After successful Afib ablation, thromboembolic risk may approximate general population risk at a charge 2 VAS 2 score. MRI-based covert stroke imaging enhances sensitivity. 96% of all patients had no new infarcts at 3 years. 96%. Choice of antithrombotic therapy must balance very low stroke risk with bleeding risk. Aspirin may be a reasonable option in moderate risk patients after successful ablation. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.